What happens when the government decides to maintain Medicare Advantage rates for the year 2025? How does it affect the insurers who play a pivotal role in this landscape? Insurers are instrumental players in the Medicare Advantage ecosystem. They depend on the government-set rates to map out their service offerings, oversee their financial health, and strategize for future expansion. Typically, these corporations anticipate annual rate adjustments to stay in sync with inflating healthcare costs, inflation, and other economic influences. An upward adjustment in rates translates into more funds for them, allowing for enhanced plan benefits, better services, or improved profit margins. But here's the twist. When the government freezes these rates, insurers find themselves compelled to reassess their financial models and operational strategies. They're faced with the task of maintaining profitability without the cushion of additional government reimbursements. The solutions? Well, they might have to trim costs, which could potentially affect the quality or breadth of services offered to enrollees. But it's not all doom and gloom. Insurers might choose to innovate, discovering more efficient methods to provide high-quality care without relying on additional funding. This decision to maintain the 2025 rates does not simply exist in a vacuum. It's a reflection of the government's broader healthcare priorities and fiscal policies. Keeping rates stable could be a move to ensure the sustainability of the Medicare Advantage program, or it could be a reaction to wider economic conditions. So what does this all mean for the insurers? They're now in a challenging position, forced to strike a balance between maintaining profitability and providing quality services to enrollees. It's a tightrope walk, but one that could lead to innovative solutions and improved efficiencies in the healthcare sector. In a nutshell, the decision to maintain 2025 Medicare Advantage rates is a game changer. It sends ripples throughout the healthcare sector, forcing insurers to adapt, innovate, and rethink their strategies. It's a complex interplay of policy, economics, and healthcare that underscores the vital role insurers play in the broader healthcare landscape. Insurers are now in a challenging position, balancing profitability with the need to provide quality services to enrollees. But what about the enrollees? How does this decision impact the millions of Americans relying on Medicare Advantage plans? For enrollees, the unchanged rates can have a direct influence on their healthcare services and benefits. They might experience modifications in their plan offerings as insurers recalibrate in response to the steady rate environment. This could spark fears of reduced benefits or increased out-of-pocket costs. However, the silver lining could be a more predictable and stable landscape for Medicare Advantage plans. This decision also paints a broader picture of the government's healthcare priorities and fiscal policies. By maintaining the rates, the government might be striving to ensure the sustainability of the Medicare Advantage program, or it might be a reaction to wider economic conditions. For enrollees, this decision is a clear signal of the government's commitment to a balanced approach to healthcare funding. It underscores the government's dedication to not abruptly shift costs onto individuals, promoting a fair and balanced healthcare landscape. Beyond the insurers and enrollees, this decision has a ripple effect. But what are these wider implications? Well, it extends its influence to healthcare providers, policy analysts, and even the overall economy. This decision poses significant questions about the government's approach to healthcare policy. It raises eyebrows about how it balances the interests of private insurers with the pressing need to provide affordable, quality care to senior citizens. This decision also sets the stage for ongoing debates about the future of healthcare in the U.S. It forces us to consider the role of private insurers in public health programs and the sustainability of Medicare Advantage as a model for delivering Medicare benefits. In the grand scheme, this decision is a complex interplay of policy, economics, and healthcare that shapes the future landscape of healthcare services in the country. It's not just a simple policy decision, it's a strategic move that touches the lives of millions of Americans.